Part of being an active person means that you're learning about your body constantly. Hi guys, I'm Dr. Chloe Costigan here from Mobility Doc. For those of you guys who know me, I am very active. I run, I bike, I walk an insane amount. And one of the things that never ceases to surprise me is that I'm yet again learning something new about my body. So what I wanted to do was another kind of hybrid of taking my personal experience and then also my knowledge related to mechanics from the world of physical therapy and combine those two. I have been dealing with some foot and big toe specifically issues. What we're going to start with is understanding a little bit of what's going on from a mechanics perspective. So we'll dive into a little bit of anatomy, one of my favorites, and then that's going to help to serve as a little bit of a foundation of what we're going to do to address the pain. Ultimately, this is going to help me to address my pain, and it's going to be helpful for you guys in terms of being able to start to address some of this on your own. But of course, if you ever feel like you're in a little bit of a roadblock, or there's also some other complicating factors, that is when it's very important to make sure that you touch base with someone who can individualize the program for you. I'm really excited to share this with you guys because this is a really great opportunity to be able to learn more about yourself and how your body moves, so that way you can continue to be active in the way that you want. All right guys, let's take a look at this foot. So we're going to be concentrating a little bit on this big toe area. This is where I've been having some of my pain. Your big toe has to be able to extend. That means that your big toe, if we're looking now on this on the inside, your big toe has to be able to go from this position to this position, up into extension. That is what's going to allow you to properly utilize your glute. But the thing though is that we end up developing some issues where if we lack some range of motion somewhere in our foot, ankle, possibly even the knee and the hip, then we can end up developing a sort of little bunion or something that's bunion-like, where you get like a little bit of extra bone that kind of grows through here, and or this toe starts to come in a little bit. So what we need to do is we need to make sure that this big toe can move how it's supposed to. What also happens is sometimes we end up getting issues through these other metatarsals, so plantar plate injury, a neuroma, something like that, because we're not pushing off enough from our big toe. Sometimes people will develop stress fractures into these metatarsals. Sometimes you develop some pain here. Now, part of looking at the flexibility of the big toe is kind of understanding, okay, well, what are we trying to improve? So here's the bottom of the foot. This is what we generically will call the plantar fascia, and it's also what's called the aponeurosis, that's connective tissue. Now, sometimes this is tight, but it's a lot more complicated than that because we also have some extrinsic and intrinsic foot muscles. So what I mean by that is we have these muscles like the flexor hallucis longus, that's this tendon here. A lot of times when I kind of work through here, and you're going to see this in a moment, that's what ends up being a little bit of the issue. And this muscle actually goes all the way up through the ankle. Let's take a look at that. So if here is your calf, we're going to take away this gastroc muscle. There's your Achilles. And then we're going to move into, here's that soleus. But now deep to that, now we're looking at these long flexors. That's what we call them. So we have your flexor digitorum longus, you have your posterior tib, and your flexor hallucis longus. Those all attach in through your foot actually. So oftentimes too, we have to focus on this flexibility through the calf and also around this part of your ankle, because that's what allows you to be able to make sure that you're utilizing that full flexibility of your foot. The first thing we're going to do is we're going to work on the flexibility through this bottom part of the foot. So we're going to do foot, calf, but we're even going to move up through the leg and through the hip. We're going to focus on this big toe. I'm going to show you some self massage and mobilization, and then we'll use the ball too. But we really want to make sure that we get through this whole part of the foot. So we need to make sure we get all of this musculature around here, get all of this to loosen up, because there are so many layers to the foot. So we have this first layer of muscles, then we have this second layer, and then finally there's a third layer. So there's a lot to work through. We need to make sure that all of this is functioning how it's supposed to, because this provides some of the intrinsic foot stability. The other thing that we're going to focus on today is this whole calf area and some of these deep flexors. So I'm going to work on using the Tack and Floss through this part of the ankle, really making sure that all this connective tissue and this retinaculum is kind of moving how it's supposed to. That's going to make sure that it's not pulling too much on this inner part of the heel, and it's going to allow those tendons. So then here, if you look at these long flexors, for them to be able to move how they're supposed to, so they're not creating too much stress on any part of that bone, particularly that big toe. toe. So I'm first gonna start with some scanning through that bottom part of the foot. So I have a ball. I'm gonna use this. It needs to be small enough and hard enough that you can kind of get through all of those intrinsic foot muscles that I was showing you. So you're going to roll through this bottom part of your foot just like this. So I wanna try to scan this whole area. So I'm gonna go along those metatarsal heads like how I had showed you, and then I'm coming along this edge of my foot. I'm kind of scanning through that entire area. If you remember that picture in the book, what I was doing was I was trying to give you guys an idea of all of those muscles you should be trying to kind of roll through. That's what's going to make sure that everything can move the way that it's supposed to, because if we want that big toe to be able to extend, if we want that normal force to be able to go through the leg, then we have to be able to make sure that all of those muscles are nice and loose. You're gonna scan through this area for about a minute, okay? The next thing I'll do is I'll cross my leg, and I'm actually gonna go through all of these muscles myself. So I'll use my thumbs and I'll kind of come across, like I'll find that big toe, and then I'll kind of move across where that plantar plate is, and I'll just kind of like press a little bit and kind of see what I feel. So I'm just kind of scanning through that whole area. I also like to kind of come along that outer edge of my foot, and I'll come in through here and just kind of work through some of those muscles. You can use the ball. I just find that this just gives me a little bit of extra pressure, and then I can move a little bit back and forth. So in between that plantar plate, so if here's kind of the front of my foot, and then also the back, so that back part is where that plantar plate is, I'll just kind of put my fingers kind of in between where I feel like that bony part of the foot, and then I'll just kind of go back and forth just like this. I'll do that for about 2 minutes. Now we're gonna stretch the big toe, okay? So this is step one. So being able to stretch that big toe means that I'm dorsiflexing my foot, and then I'm trying to pull my big toe back, okay? So I need to make sure that all my toes are pointing back. I'm not turning my foot or anything like that. My foot is going directly back, and I'm pulling my toe back. So I'm gonna hold that big toe stretch for about 30 seconds. I'm making sure that I'm not pushing it down and I'm not pulling it up. It's going directly toward my knee. And that whole time I'm trying to dorsiflex my ankle as well. What I like to do is I like to do about a minute on the ball or a minute of self-massage, and then a 30-second big toe stretch, and I go back and forth for a total of 3 times. Now we can't forget about those deep flexors in the calf. So remember, these muscles that are in the back of the calf, they attach down into this foot. So I'm gonna foam roll through my calf. What I like to do is I like to cross my right leg over my left as I'm rolling that left calf, and then I'm just going back and forth. So you notice though how I'm not really lifting my butt up that much. I'm just kind of using my shoulders just to kind of like push me forward and back over that roller. And then what I'm doing is I'm scanning through that whole calf, okay? So I'm trying to, it's like I'm painting a wall. So I'm getting this inside part of the calf, low down by that heel along the Achilles. It feels particularly tight for me on this inner part. And then I'm coming along this outside. So I'm giving myself a full 2 minutes to be able to scan through this area, okay? Yes, this seems like this is pretty long, but it will be incredibly helpful. So I just want to take that full 2 minutes to be able to just go through that whole area. In the last 30 seconds or so, you can hold wherever it feels tight, and you're going to point your foot back and forth. So then that whole time I'm trying to point my foot, and I'm trying to take note of the position that my ankle is in. I tend to, because I have more flexibility, kind of turning my foot in. What I'm trying to do is I'm trying to do this back and forth motion, just like that, okay? So I'm really trying to think about making sure that that foot is pointing straight ahead. When I do that for the last 30 seconds, making sure to move those toes too. One of my absolute favorite calf stretches is a single leg down dog. We're going to up the ante a little bit by doing tack and floss. So I'm gonna do tack and floss actually in the muscle belly. So I'm gonna take that piece of floss. TheraBand won't really do. You kind of need something that's this like thick rubber. So we use Rock Tape's brand, it's called Rock Floss. But I'm gonna wrap this calf in about like a 3-inch area or so. Really, and I'm pulling pulling this pretty tight as I do it, because then I'm going to temporarily decrease blood flow to the area to then allow for an increase in blood flow to the area. It's also really helpful for getting that connective tissue to loosen up. Then what I'm going to do is I'll go into that calf stretch. So I'll push back in a down dog, then I'll drop that left heel down, and then I'll cross my right leg behind my left leg. Now this whole time what I'm trying to focus on is making sure that my toes are pointing forward. So my toes are probably going to be inclined to kind of turn out to the side. I want them pointing forward that whole time. I'm going to hold for 30 seconds. From the side, I'm dropping that heel down, so then I feel that stretch all through that back part of the calf. And I'm really trying to make sure that I'm not turning those toes out to the side. I want my foot pointing forward, and I'm going to drop that heel down. I'm going to hold for 30 seconds. This is my step one for rehabbing your foot and your ankle. So start with doing the massage to the foot, whether you use the ball or your hands. Then you're going to do the seated big toe stretch. You're going to alternate back and forth for 3 rounds. You're going to massage for 1 to 2 minutes, and then you're going to do the big toe stretch for 30 seconds. Then we're going to move on to the calf. You're going to do 3 rounds of foam rolling through the calf for 2 minutes, and then doing the single leg down dog stretch. You can add the tack and floss to make it a little bit more challenging. We're starting with the basics. I always say, let's start with the most simple thing, and then we'll add on layers from there. So what I would suggest is trying these first. In that anatomy lesson, the thing that we went over was the fact that you need to be able to push off from your big toe. But one of the prerequisites for that is the flexibility through your calf. So you need to be able to have at least 10 degrees of dorsiflexion in order to be able to have the proper mechanics that will allow you to be able to push off from your big toe. So we need dorsiflexion range of motion at the ankle, and then we need big toe extension. For this first week, we are working on the flexibility of those, because if you don't have that flexibility, then it doesn't matter what amount of strengthening you're going to be doing, you're not going to be able to reap the benefits of that. So let's first start with improving that flexibility, and then we'll add on the layers from there. If you like this or found it to be useful, or both, please share it with someone that you know so they can get more out of their stretches as well.